So it's interesting because a recent survey from last year estimated that there's going to be a 7% increase year over year for our healthcare costs for 2024, which is much higher than what we have been seeing years before. I think 2022, they said 5.5% increase. So that being said, how can organizations adapt to the increasing need for a positive patient financial experience in light of patients paying more for their healthcare costs right now? So Melissa, I know Ochsner places a very heavy focus on the patient experience. So would you like to start us off today?
Sure. Thank you, Amanda. So we really believe that the financial journey begins with the patient and making sure that they're educated and they understand upfront what their costs are going to be and what to expect along the way. We've created a financial resource center on our Ochsner.org website that contains information for the patients. It has a pamphlet on the financial journey from start to finish, from the time of scheduling, how they can apply for financial assistance programs, how they can obtain estimates. And it starts at the beginning. We also have videos. We've done road shows. We've participated in health fairs. We even set up a kiosk in the mall at one point to try and help educate our patients. So just all around, it's starting with the patient, meeting them where they are, making sure that they understand what healthcare is going to cost and how their insurance works.
Yeah. And Heather, what are your thoughts?
I love everything that Melissa just said. We have a lot of resources on our website, but I think going to the mall and doing some direct to patient outreach is a brilliant idea. The other thing I think that we're really trying to work on is we have a pretty robust bundles program where we're going out to employers and offering some direct to employer bundle programs where patients won't see an out-of-pocket cost. And that's been really, really successful. We've been piloting it within our own organization and with our Metro Nashville school system. And the patients really love it. They get great experience, concierge service, and it doesn't cost them anything. So I think going out and trying to partner in different ways with different organizations, being that many of those employers are now self-funded, they do have the option to do some more direct for patient kind of care and kind of get the middleman or the payer out of the mix, is really helping to reduce some of those costs for the patients in the end. So on top of what Melissa said, I'd say that if you have an opportunity to grow a direct to employer bundles program, it's really where we're starting to see the market shift to.
Nice. Yeah. And Brandon, what about you? What's going on at Community Health?
Yeah, so within revenue cycle, I think it's been challenging, right? Because on the West Coast, if you're following, right, we've had lovely Senate bills, which are now having us raise minimum wages to levels a lot faster than we would have wanted to raise them in healthcare. And then that comes at a cost to the organization because you have compression and you've got to raise everybody up. And it's just very, very challenging in our market to retain talent. It's very competitive. But what I really take as our responsibility in revenue cycle, and it's for our patients, right, is we have to think about it's their money that we're spending, right? So when you have an opportunity to cut a cost, right, work with the vendors, have savings, get people enrolled in coverage, it's our way of giving back, right? We always think about revenue cycle as the engine that's bringing the money into the organization. But I like to challenge ourselves and say we can also save the organization money too, right? Because every dollar we save, every time we have the ability to reduce waste through our process, we're able to spend money elsewhere in the organization. Could be a new clinical tool, could be something in another department. So really keeping that at home, right? And saying it's not only the revenue that we bring to our organization, but it's the money that we save. So, and it's not about reducing staff. It could be about taking staff over here, automating something, and then putting them on something else that's more complex, or upskilling folks and training them. So it's not always about reduction, it's about change. And change is the most difficult. And I think we have the responsibility on both sides of that equation.